Let's talk about health now, because this afternoon there's help out there for anyone nursing suicidal thoughts. That's according to the Mental Health Authority, following revelations that as many as 417 people have attempted suicide as of June 2021. There are others that are also not reported because of stigma and fear of community repercussions. Acting Head Health Promotions at the authority, Dr. Yao Amankwafa, says the situation is worrying and needs urgent intervention. The Mental Health Authority is this afternoon engaging some students in senior high schools in the country. We'll go live to the Accra Girls Senior High School where this engagement is happening. Before that, though, head of psychiatry unit at the Komfanoche Teaching Hospital is making a strong case for decriminalization of suicide in the country. Dr. Ruth Owusu-Entry says arrest and prosecution of persons who attempt suicide do not deter and prevent such acts, but rather encourage the act. She says research conducted at the Kumasi Central Prisons revealed victims who attempted suicide are spending time at the prisons, trying several times to end their lives. Dr. Owusu-Entry wants the state to introduce suicide-friendly policies, including provision of psychosocial support to victims to deal with the menace. She has been speaking at the World Suicide Prevention Day organized by the Ashanti Regional Health Directorate.
For several crimes, not just for suicide attempt, for several crimes, we realized that those in the prisons, on the average, had attempted suicide 9 times. And that was used to buttress our point that it is high time to decriminalize suicide attempt. Because guess what? Those who are in suicide, of course, not just for suicide attempt, but for other reasons, have had the opportunity to even attempt whilst in suicide. So criminalizing the suicide attempt does not serve as a deterrent. You may as well put someone behind bars or imprison someone because of suicide attempt, and the person will still go on and want to end their life. Because research, several research around the world have proven that suicide attempts usually have underlying untreated medical conditions. And so why would you want to punish someone who is going through or battling a mental health problem or battling one trauma or the other? You will end up pushing the person to actually complete it. And once it is a criminal offense, it also prevents health workers and researchers to get accurate data that will inform policy change, because nobody will openly admit that I have attempted suicide because they know the consequences. And so we are unable to get accurate data to be able to inform policy change. And I think that if suicide attempt will be decriminalized, we would be able to send help to many people who are suffering in silence and bring these figures that are currently soaring in the country, especially in Ashanti region, to the barest minimum.
Okay, so, Doc, let's talk about the fact that in the Ashanti region, between January and June, the region has recorded 13 attempted suicides, 63 attempted suicide, and 13 successful committed suicide in the region. People or persons with suicidal thoughts, what kind of support is available for such people in the region?
Currently, we have just one specialist psychiatric unit in the region, which is located in Komfanoche Teaching Hospital. That is where I work as a psychiatrist. And I think that for a region as large as Komfanoche, Ashanti region, our unit is too small to offer all the help. We do our best. Until recently, we had just one clinical psychologist working in the department, but having sought for increased numbers in our clinical psychology staff, our CEO and the hospital management have been able to push and giving us more clinical psychologists to help. But there is still another problem of space. I quite recall when some time back, a patient came to our unit who was critically ill, was going through a lot of psychotic episode, needed admission, but all our 11 beds were fully occupied, and everybody on the bed was critically ill, needed admission. And so we had to let this patient go home with a caution to the relatives to keep an eye on her. The following day, this person jumped from the 3rd floor and killed himself. And imagine if we had had space for this person on the ward, they would have gotten the right kind of help, and we could have saved just his life. We could have saved his life. And so we have been pushing for an expansion of our unit. We currently serve the entire Middle Belt, Northern Belt, Northern Region, Upper East, Upper West. Most people still come down to our unit for help. And we have said over and over again that 11 beds are simply inadequate to cater for the numbers we see. At the OPD alone, we see over 15,000 cases a year. And if just 15 of them can be admitted when they get to critical cases, then I'm not surprised at the soaring numbers of suicide we are seeing in the region.
Let's have a conversation about this phenomenon, and joining me via Zoom is Acting Head of Health Promotions at the Mental Health Authority, Dr. Iyawa Mankwa, for this. Doc, I'm grateful that you joined us this afternoon. Let's start with the worrying statistics of 417 people having attempted suicide as of June 2021. Has this always been the case? I mean, compared to the periods, but more importantly, what has your research shown to be the major causal factor? Hello, Doc. All right, so let's try and fix her Zoom properly and have that conversation about the suicidal thoughts that people nurse, because there's help out there for you this afternoon. That's according to the Mental Health Authority, because they say that as many as 417 people have attempted suicide as of June 2021. That's just half of the year. There are others that are also not reported because of stigma and fear of community repercussions. This afternoon, Dr. Iyawa Mankwa, who is in charge of promotions, is calling for the issue to be dealt with accordingly, and he joins me via Zoom this afternoon. All right, so Dr. Mankwa, if you can hear me, I'm asking you to tell me more about your research that is revealing that 417 people have attempted suicide already between January and July 2021. I'm asking you to tell me what the causal factors are per your research.
For your question, per our research, well, we have a management software system that we use to collect this data, and according to our system, we have noticed that 417 people have attempted to die by suicide. You know, we've told the media several times that we are trying to decriminalize suicide, so we do not like to use the word suicide. We say die by suicide. Yes, back to your question, what are the underlying factors? The basic underlying factors are psychosocial factors and mental health factors. You know, the daily hustles of life, we go through several problems. It could be financial, it could be accommodation, it could be marital, it could be anything that could impact us seriously. Aside that, underlying mental health issues as a result of stress and all that is also a factor. So these two together makes it unbearable for somebody to deal with it, and for that person will decide that the only way out of this problem is to die by suicide. So these are underlying factors that people decide or intend to commit and die by suicide.
All right, so I'm aware that you're engaging some senior high school students on this matter. What's your objective?
Well, the objective is the data we have is a lot of youth. I mean, the suicide that has been reported, even in the media, points that a lot of youth are dying by suicide. So we decided that, well, this year, let's get into where we can have an access to lots of them and talk to them. So, well, we can't be at every place at the same time. So we chose our female schools, and Accra Girls Senior High School happened to be the lucky one. So we are here today to provide that awareness program for them, as well as to provide psychological first aid for them. We came here with, in fact, this program was organized in collaboration with the Ghana Health Service and the Ghana Psychological Association. So we are here to provide that awareness for them, educating them about suicide, and as well as providing that psychological first aid for them, so that they'll be familiar with the warning signs, what they can do to help themselves and others, what the risk factors are, what protective factors that they need to, if somebody, they are able to determine or identify that somebody has intent of dying by suicide, what help they can provide. Through the education, we're able to tell them that there is help out there. There is a lot of professionals out there in our hospitals, in our district hospitals, who are more than ready to listen to stories and help them.
So why girls' schools? I mean, is it because there are more girls committing suicide than boys?
Well, you have answered the question. You have answered the question. We find that the girls are vulnerable. We find that the girls are vulnerable, and there are lots of them here, so we need to talk to them. I mean, even if it's boys' school, yes, we can go to an equally boys' school, but we find out that girls are vulnerable, so they are impacted by a whole lot of social issues, so we needed to talk to them. And this place, they happen. I mean, there is St. Mary's, St. Mary's Girls' School, and there is the other one, day school. But these Accra Girls happen to be the lucky one. We are not ending it here. We'll be going to all of them to engage and educate them.
All schools. But the figure we are talking about, the 417, how many of those in there are girls and how many are boys or males or females?
Well, at this point, permit me, I cannot provide you with that breakdown. But we know that there are a lot of females in there. I cannot give you that specific details.
Okay. So what are some of the issues that are...
provide you with that specific details.
What are some of the issues that are coming up from your engagement with the students? What are they telling you?
Well, for what we did, we provided our awareness program and educated them about suicide, what the warning signs are. The clinical psychologists are providing them with the first aid. So if they are going to provide details about what is going on in their life, it will be with the psychologist. But I'm afraid the issue of confidentiality will not let them divulge that, even to me. So the real issues that are happening to them, I do not know. But they were interested very much in the science and the kind of help that is available there, which we give to them. And that's just through professionals and connecting with their communities, society, friends, and family.
So share with us the triggers, the early signs that you've been sharing with these students.
Fantastic question. Well, interestingly, research has shown that anybody who intends to die by suicide expressly says that they threaten to harm themselves or kill themselves. That is what they do. It's by expressing that they are basically, in other words, crying out for help. That
All right, so we're losing Dr. Amankwa there, but he definitely has to come back for us to have this very important conversation. And this, in fact, the part that matters to me the most, the triggers, the signs, the early warnings, so that someone can be of help to another who needs that help. Dr. Amankwa, if you're back, I want to hear about these signs. All right, so Dr. Amankwa will join us via phone because we definitely have to conclude this conversation. Dr. Amankwa, tell me more about the signs and the warnings on the wall, which we must read before this happens.
Can you hear me now?
Yes, loud and clear.
Very good. So like I did say earlier on, the person would directly tell you that I want to harm or kill myself. That is a common major sign that they provide. And like I did say, I don't know if I went off that at that time. It's a cry for help when they give that indication. Others would simply send a text message that I'm traveling, or take care of my family, take care of my children, take care of this for me. When indeed you realize that there is something wrong with that message, your instinct will tell you that there's something wrong with that message. Also, others would openly express hopelessness that they are tired of this world, they want to die. Others will go as far as making their own funeral arrangements. Others will start abusing alcohol and substances. So these are some of the signs.
Dr. Amankwa, don't go yet. If we see those signs, what do you recommend that we do? If you see a friend, a neighbor acting in that manner, what do you recommend that people close by do to prevent such occurrences?
You can do is to approach the person in an empathetic manner and ask the friend if they have intentions of
Dr. Amankwa, you have to reposition yourself. There's so much noise from where we are reaching you from. If you can go to a more quiet place so we can really hear what you're telling us. So Dr. Amankwa has been talking about the triggers, and he says some of them will tell you bluntly in the face, I want to kill myself. Some will also resort to alcohol, smoking, they'll coil back into their shells and be by themselves. And all these, he says, are triggers that people want to really commit suicide. Earlier, he didn't want to share some of the things that make people do that, but he mentioned that if you look at the trend and the research, there are more females than males. The reason why they've decided to go to girls' schools to preach and explain to them why they should not take their lives. When he joins me again, we'll be talking about the strong case they're making for decriminalization of suicide in the country. They think this actually will help because if we have friendly policies and also including psychotherapies for people like this, this is what they think will end the suicide missions that people go through, or rather than criminalizing this, because they say that people go to the prisons and still continue with that thought of ending their lives. So we have Dr. Amankwa back. Dr. Amankwa, if you're back, let's go into how we can offer help to our neighbors if we find them in those situations. Dr. Amankwa, you were telling me about how we can offer help to people who find themselves in these situations. What can we do? What do you recommend that we do?
I think it's a straightforward question that we need to teach to this individual. For that individual to confirm that indeed they have to get consent. So we ask the person directly, without fear, non-judgmentally, are you intending to kill yourself? Are you trying to kill yourself? In most cases, they respond to yes. That confirms that the person has intention of doing that. And the next step is to bring in other professionals or family members